what happens with a fracture dislocation? Well, the most important is to line up the joint first. So no matter what, you can have a break and some displacement, but the most important thing you can do is line up the joint. So you have good symmetry, which means that the joint spaces line up. So in the ankle, think of it like a U-shaped horseshoe with a block in there, and the ankle lines up. You have a malleoli on both sides, which are part of the ankle bones. And essentially, if that lines up on multiple views, typically on at least 2 to 3 views, then you have reasonable alignment. And the reason for that is, yep, you got it. I heard you out there. What did you say? Reduce the risk of cartilage injury and post-traumatic arthropathy or cartilage degeneration, impact, or anything. Now, when you have a fracture, is it in the joint, outside the joint? If it involves cartilage or doesn't involve cartilage? There are so many facets in fractures. Now, as far as we know, it wasn't an open fracture. Open fracture is when any part of the break or the dislocation communicates with outside the skin. So you could have a little abrasion, but if it doesn't penetrate and go right into the joint, then it's not an open fracture. Open fracture, higher risk of infection, higher complication rate, longer treatment to make sure it's not infected, and then the healing. All of those factors come into play because you have exposed air from outside exposing the interior space, which is typically sterile.